chapter 6, which is the estrogen fix and your brain. Now that's a big issue, Dr. Mache. Brain fog is rampant in women that are going through perimenopause or menopause. I still remember walking into a room and having no clue why I had just walked in here. So tell us a little bit about...
At least you remember it was a problem. That's a good start. Look,
very true. I didn't know it was a problem. When I forgot in the middle of speaking to my husband what exactly I was saying, we all knew it was a problem. Thank God I got rid of it.
Yes, indeed. Estrogen is very important for the brain in women. Very important. One of the things that causes the mood swings, the sort of foggy brain and the poor areas of thinking has to do with the fact that estrogen increases the speed in which the nerves of the brain communicate with each other. So you've got basically the brain is just an enormous series of short nerves, one connecting to the next, and then they spread out like this huge web, but it's all wound together in this amazing computer, like the most amazing engineering and wiring job you've ever seen in your life. The way we think or move is by one of those nerves talking to the next, goes to the next, to the next. It hits a bifurcation. It goes one, some goes that way, some goes this way, and then they talk to the next, and so forth. Estrogen speeds up the quickness that happens. So it's going to help your balance, going to help your mood, it's going to help your cognition, your thinking. Where it matters a lot is in a couple of areas in particular, because usually those problem areas are going to get better in about 3 to 5 years. There's going to be a window when it can be very challenging, but they may get better without taking hormone therapy. Now, here's a couple of examples where it's really important to know about. Number one, if you go into early menopause, and you don't take hormone therapy, your risk for dementia goes up to as much as 70% more.
Wow.
This is a big deal.
That's huge.
It's amazingly huge. That's number one. Number two, if you do take estrogen, and this is a report that came out just in the last few months, if you do take estrogen, your chances of getting dementia go down amazingly as long as you stay on it for a window of time and you started it in your estrogen window. So, and if you want to prevent dementia or lower the chance of it, I can't tell anyone they can prevent it, but they can lower their chances of it significantly. You start it if you go into early menopause at the time that you go into menopause, and you stay on it at least until 51 or so, which is the age at which you go through menopause naturally. So that's very important. The other area is that there are a lot of people, probably 30% of the population has a mental health issue. Could be depression, could be bipolar, could be anxiety, could be any of a number of conditions. When you have this as an underlying problem and go through menopause, if menopause isn't treated, then your problem, your mental health problem, could become less easy to control. So this becomes very important to work with your healthcare provider. And when I see women in my practice, at Beth Israel Hospital, or when I do menopause coaching with women by phone or Skype, a lot of it has to do with mental health issues and helping women get through this period of time, because depression, anxiety is unfortunately all too common. Some of it will pass, but if you have an underlying mental health issue, not so much.